Hello everyone, my name is Tohid Fatahi. I am a student at UCLA taking Phi-Sci 121, and today I'm going to be going over some physical therapy that boys with Duchenne Muscular Dystrophy, or DMD, should be doing. To understand why boys with DMD need to stretch, we must first understand what causes the disease and what effect DMD has on the muscles. DMD is a condition that affects all of the muscles of the body, causing them to become progressively weaker. It is caused by a lack of the protein dystrophin in the muscle cell. Dystrophin is responsible for keeping muscles strong and healthy. Without dystrophin, the body cannot generate muscle tissue properly. Well then, why is stretching important? The main goal behind stretching is to minimize contractures, which are common in neuromuscular illnesses like DMD. We can also see them in Becker muscular dystrophy as well. The inability of a muscle to complete a passive full range of motion is referred to as a contracture. Contractures are caused by a combination of restricted muscular mobility and the replacement of muscle with fibrotic tissue. To combat these contractures, I will show you a few stretches you can do, and at the end of the video, I will go over why minimizing these contractures will improve the overall health and the daily life of a boy with DMD. Alright, so the first stretch you want to do to your boy with DMD is an assisted hamstring stretch. The way you do this, you grab your leg and you go slowly up, stretching the hamstring. This stretch is important because the hamstring right here, this muscle in the back of the leg, connects the knee to the hips. Two of the most important flexors for mobility. We want to make the hamstrings loose, and this will relieve contractures. You want to go to the feeling no pain. How's it? Feeling it? On a normal person, they might be able to bear more stretch. Beware, a person with DMD might not be able to bear all of this stretch. Go for 10 to 20 seconds for 3 sets. The next stretch we're going to be doing is a hip mobility stretch. The way you do this is similar to how we did the hamstring stretch, but instead of having the leg bent upward like this, you want your leg bent at the knee, and you slowly bend it back. And this will give a nice stretch to the hip. Why we want to do this is because the hip connects your upper body to your lower body and is essential for movement. This will help with walking. It'll alleviate a lot of hip pain, and because the boy is normally sitting down a lot because the muscles tighten up, they're normally in a wheelchair, this stretch is very important and can in fact elongate the ability to walk for a DMD patient. We want to do this for 3 sets, 20 seconds each time. And I forgot to mention with the hamstring stretch, you want to do both legs. Furthermore, scoliosis can be caused with a boy with DMD. This stretch can help against that. Alright, so the next stretch we want to be doing is a calf stretch. This stretch is very important because boys with DMD, they normally have a larger calf than most people. So we want to do this stretch to basically relieve tension in the muscle. The way you do this, you grab the foot, you grab the calf of the DMD patient, just right here. You want to just bend the foot backwards. Again, hold it back, 3 sets, 10 to 20 seconds each time. And you want to do this on both legs. The calf connects the foot to your knee. And you want, for a patient to be able to walk, this is a very important stretch to be doing. Alright, so the next stretch we want to be doing is a forearm stretch. We do this by grabbing the arm of the boy with DMD, and you want to complete an extension. You want to do this softly so you don't hurt your boy with DMD. First, you want to extend the hand to the wrist, like so. You want to make sure they're getting a good stretch. Are you getting a good stretch? That is what you want. You do this for 3 sets, 10 to 20 seconds again. And you also want to do flexion. You bring the hand down And by doing this, you will alleviate a lot of tension in the wrists and in the forearms. Again, both arms 10 to 20 seconds for 3 sets. All in all, the main goal in doing these stretches is to alleviate tightness and contractures so that any individual with DMD can partake in activities such as walking, riding, playing video games, and many more. Stretching is important for individuals with muscular dystrophy to build and preserve range of motion and improve their overall health and fitness. I hope you found this video informative, and take care.